I'm gonna ask you the hard questions.
That's fine, go ahead.
And I might even say a few softballs up here. Now, this is the deal. I know, you talked about the patient that had the issues that y'all had to do. When they call, you said the nurse had called you and let you know that there was an issue there.
Right.
Would the law allow her to do anything before she called you?
Absolutely.
So she could have affected that.
She could have.
As her supervisor, if you were the supervisor, that she didn't have to she could have go ahead and took care of that.
She could have, but it's what I'm kind of telling you how it is in the operating room. The relationship between the nurse anesthetist and the surgeon is not the same as an anesthesiologist, a physician anesthesiologist and the surgeon. I thought about this. What would have happened to that patient if I had not gone in that room immediately and barked instructions?
Are you, so, I'm sorry.
No, that's all right. Go ahead.
But you're saying she didn't know, or the nurse did not know?
I'm not saying that she didn't know or did know. She knew what was wrong. She knew.
Yeah, you said this.
Yeah, she knew what was wrong. She told me what was wrong. And it's that next step. Okay, I know something's not right. What do I do? It's the differential diagnoses of trying to figure out what it could be. That tube could have been between the skin and the fat. It could have been pushed up against a wall. So she could have flipped the patient over, but I don't think that was gonna happen.
Okay, thanks, sir. So there is an issue of education. And if you don't mind, sir, I got a few more.
Okay, I'm sorry. I keep
So
thinking
it
you
was,
finished.
it was the competence of the nurse anesthetist. Is that what it is?
No, it's the nurse anesthetists are extremely competent in the operating room where we work together. Okay? It's not competence. They're certainly educated. We work well together, but it takes what you were asking about. Who's the leader? Who's in charge? And I'm in charge. And I think I tried to explain the situation previously. You know, me walking in the room, looking at my surgical peer and telling him this is what's gonna happen now, because if he would have had a discussion with the nurse anesthetist, say I wasn't there, I kind of think how this is gonna go. It goes like this. They spend some time, a minute, 40 seconds. They know they're in trouble, trying to figure out what's going on. But the problem comes up when they look to the surgeon and say that we have a problem. We were gonna have a problem in about a minute and 45 seconds in this situation, okay? This obese man's oxygen was going down. When they tell that surgeon, hey, we got a problem, the surgeon's working, they're busy, they're focused on what they're doing, the first thing they're gonna say is, you know, what's the matter? And the explanation for the next 30 seconds has to go on.
I understand.
That takes place. Not that the nurse doesn't know that we're in trouble, the nurse anesthetist, but the surgeon then.
Yeah, I understand. So this was post-op?
Now this was during surgery. This was during the surgical procedure of working on the wounds on this gentleman's buttocks. He was face down on the bed with that trach in place, with the anesthesia machine connected to his breathing tube, which you couldn't get to. I kind of got cut off with my 3 minutes. I had a little more to say.
And that is, I'm trying to put it all together.
Mm-hmm.
I want to see clear what you're telling me. You ran to them, if you had to run in there and fix that.
Yeah, I was no further than from here to the medallion.
Was during surgery.
During surgery?
And, but that is what got that guy back to breathing. Because I asked before that if they had airway management curriculum training in the school, and they all said yes. I don't know how much, because I heard a lot of people, it's airway management, they gotta know how to do that. Well, when I started digging down, they do know how to do do.
They absolutely know
And
airway management.
And that's why I'm asking you the hard questions, because when I don't, or we maybe, don't understand, you say I ran to them when she called. I thought the operating table, y'all were closer than that, to, you know what I mean, to have to physically get there in time to do that. And I'm not trying to be mean or smart, I just want to know and learn. But that is, and the care team, you said that you like the care team package now, that's with a nurse, an anesthesiologist and a surgeon?
No,
Okay.
anesthesiologist and a nurse, that is the nurse anesthetist, CRNA. Those two people make up the anesthesia care team in our world.
Okay.
In their world, practicing alone, they try to say that it's the nurse anesthetist, the nurse in the room, the tech in the room, and the surgeon.
And this is the way and I asked this question last week in the meeting, and I got an answer, and I went back and checked on it, and it wasn't quite true what I got.
From opposition or
They're saying
for?
that a care team removes the anesthesiologist. If they done away with the care team, this law passed, it would move the anesthesiologist out of the care team. That was not what I've got from many people, professionals that I asked.
There's
They
absolute.
leave that in there. They can leave that whole team together, just like with a nurse, CRNA, with the anesthesiologist and the surgeon or a physician that's in there doing the surgery. They can leave that whole team together. And I understand about safety. I'm telling all of you for listening to me and help me understand if you get a chance to talk. I know it's all about safety. If it's 1 to 4 ratio, and y'all say that's the safest thing we can do with this care team package, why would not have an anesthesiologist in every room? That would be the safest way to do it.
Because they don't exist, we're not training that
Yes,
many.
sir. Yes, sir. And that is a point I want to make too.
But
We have to try to be open-minded to understand we need help. The best help without jeopardizing, put anybody in an unsafe condition.
Right.
But that, if 4 to 1, there's gotta be definitely some trust there. There's 4 nurses to 1 anesthesiologist or physician watching those 4 patients. There's gotta be trust.
Oh, there's
That they
absolute
can
trust.
do, that they can do what they do. And that is why I understood the law to say, they have to notify an anesthesiologist if they notice a problem. And that's why I asked you that first question. They just couldn't go in there and do it and not let you know anything about it, or the anesthesiologist or the surgeon.
Well, we're a team, and that's, what we preach in my facility is that we need to be kept up to date. We need to know what's going on. But you heard last week that from the nurse anesthetist side, that anesthesia is really safe. And anesthesia is really safe.
I have 2 folders here showing.
Until the moment it's not. And you do not want to be that patient when the moment it's not.
Yes, sir, I agree. And thank you, I didn't,
No, you're good.
it's all good, sir. Appreciate you trying, or answering the question.
Thank you very much.